Hello guys, today we are going to talk about nursing stuff again. As you see, we are wearing again our nursing scrub suits.
Yeah.
So today I guess this is quite interesting because we're going to compare nursing student life in the Philippines and
In Finland.
yes, and I guess this is quite interesting also for students who are coming here to study nursing, and also in general for people also to know back in the Philippines to know what is it like to study nursing here in Finland. Sorry, in Finland.
Yeah.
Yes. So first, let's ask Linda why she took nursing. Why you took nursing?
I did not really have a dream to become a nurse, as some might have.
Same with me.
But so when I had to choose a profession, then I was like thinking, what can I do that is somehow helping someone else? And the only thing I can think of is nursing. So that's how I ended up there.
And you chose to be in an international class when in fact you can actually study nursing in your own mother tongue, right?
Yeah, I applied
So-
for both.
Okay.
But then I chose the international, the English program.
Why did you decide so?
I don't actually know
Decided
why.
so.
I just, when I learned that there is an international program, I was just like, I will try to get in. I was not so comfortable with English even at the time. So maybe, yeah, I don't really know why. But I think it was a good idea. Like it was a good thing that I chose because it was really nice to be in the international one. Yeah. How about you? Why did you choose
Well,
nursing?
it's quite different story because first of all, nursing was a way for people in the Philippines to go out from the country to work abroad, and at that time there were a lot of students really wanting to get into nursing school, and I didn't also dream to become a nurse. It's not part of my top 10 dream profession.
But pretty close because you wanted to be a doctor.
Yeah, I wanted to become a doctor actually. I already killed that dream. Yes, so my mom was actually working in a nursing school, and so it was the cheapest way to get into college because I had like a discounted tuition. So
Okay.
it was not really my decision to become a nurse, but it was the circumstance that made me one. And maybe I am meant to become a nurse because I like the job. Yeah, and I graduated 2007. How about you? When did you graduate?
I graduated in 2012.
Yeah, so that's quite long time ago. Don't count our age, but yeah, that's quite a long time ago. So what we're going to discuss today would be something maybe different already, like
Some things might have changed since we went to nursing
something
school,
might
but
have changed.
many things are probably the same.
Yes, so let's start with the uniforms because I think it's the uniforms and the tools when you study nursing. Because in the Philippines, if I could start, we have to buy our uniforms. It has to be white.
Do you need to wear it every day? Also for
Yes.
like-
yes. You have to.
okay.
But there are classes where you don't need to wear it. Like for example, like a PE,
Okay.
physical education class. Then you don't need to wear that. And also, we have wash days also. So there are days in the week where you don't need to wear
Okay.
the nursing uniform, but we wear it very proudly because white and medical field and like that. And also we are required to buy our own tools like stethoscope, like those things,
Scissors. What else?
and sphygmomanometer.
So the blood pressure
Yeah, the blood pressure.
measurement. What is it called?
Blood. What is it? In a layperson's language.
Well, the thing that you use to measure blood pressure.
Yes, blood pressure
Monitor.
monitor. I guess that's how
Yeah.
you call it. Sorry. And then like thermometer, those
Okay.
stuff. So how about in Finland?
Well, in Finland, you only need to wear uniform for your practical courses.
Okay.
Any other days you can wear basically whatever you want.
Oh.
Of course, yeah, with reason. But for our practical courses, we are also given the uniform from the school. Like not as our own, but you can borrow it from the school. They have a set, and you can look for your size and then you use that.
Oh.
And we don't have to get any tools or anything. Everything is from the school. So we just use what they have there.
Very different in
During our
Philippines.
classes,
Very
yeah.
different from the Philippines. And the second one, how about the lessons? How do you describe how do your lessons and exams go when you were still a student?
Well, in Finland, which is maybe the biggest difference maybe for lessons, is you always call your teacher by their first name. This goes for all school, not just for nursing school.
Okay.
And yeah, I mean, lessons are pretty in that sense laid back. Like you can always ask questions. You can you can challenge the teacher if you don't agree. And of course, because we're in an international program, people from many different parts of the world, it's pretty interesting. Everyone can bring their own things to it, and then I don't know, laid back. You don't ever have to be at least
Scared.
of course, different teachers are. We had maybe one teacher that people were a bit scared of, or not scared, but they were like.
Quite strict. Maybe.
Yeah, she was strict, so people were more like on edge in her class than other classes. But mostly, relationship with teachers and like that is very like
very
easy.
calm.
Like
Calm
you
and
can always turn to them if you have
Yeah.
problem with the class or something else.
yeah. And how about the exams and
Exams is we actually did not have that much like exams that you sit down and you write some exams. Mostly we have assignments that you write at home and you turn in. Or then the exams are, if we have them, they're mostly essay type, except in lessons like anatomy and like that, where you need to memorize.
Yeah.
So it's more, the goal is for us to really understand what we're studying, not necessarily memorize every single thing, but kind of have an overview of everything.
Oh.
Yeah. How about in the Philippines? How
Well,
is
it's quite objective in that sense that you have to memorize a lot of things. The what's this reference? Is it how do you call it? Reference number, or was it like the the blood workouts?
Okay, so the specific, the reference number of for example.
Yeah, like the
specific
normal
blood.
values.
Yeah.
We call it normal values. Sorry.
Yeah.
Yeah, we have to memorize those, and a lot of the lessons are really based by the book, and also the exams are based by the book, and you have to answer them according to what's really like.
I mean, of course, our exams are also from
Yeah,
the
yeah,
book,
yeah. But I
it's
mean,
not
like it's very
as
objective. Like
Okay,
a lot of exams are multiple choice.
okay.
A lot of exams are multiple choice. So, and also I could remember in my experience that there were really like quite strict teachers that somehow you are afraid to go inside the class if you are if you
Okay.
are late, for example. Of course, it's not quite acceptable if you're late, but but here in Finland, you don't get scared.
You don't get scared, but yeah, you should not be late
Yeah,
to
of
class
course,
in Finland, especially because that's very bad.
Yes.
Finnish people don't like if you're late.
Yes. So yeah, and what else? Maybe that's it that I could think of. Like it's very objective and very specific, the lessons, and quite theoretical, like very theoretical. Like it's really, you have to read a lot and you have to comprehend a lot. And unfortunately, we were not really asked like what we know, like as it is in Finland, that you can that the exams might be like explain this then, or what do you know about this. So you can actually just write anything as much as you know, then you can get grade from it. In Philippines, it's more like as I said, multiple choice, and if you know something but it was not asked in the exam, you might not get good grades. So that's unfortunate.
But in the end, you actually, because you still to this day remember a lot of things that
Yeah.
I don't remember, even though we studied the same thing.
So that's a good thing.
Yeah.
Yes. So next we will talk about the return demonstrations, the RDs during
Or
school.
practical exams.
Yeah, practical exams
we
in
call them
Finland.
here. Yeah.
How do you do that here to evaluate or to improve your skills? How do you do that?
Well, we have the practical course where you go through and you can
Yeah.
practice the things, whatever it might be. It might be injections. It might even be like washing someone in the bed or transferring a patient, or more advanced things like resuscitation, intubation, whatnot. So usually during the course we practice it. And then in the end there will be an exam where you have to show how you do it. So either there will be like, well, for injection you will just show from beginning to end how you would do the injections, including the aseptics, that how you talk
Yeah.
to the patients, and giving the actual injections, what you do after that. And
Do you have to explain it every steps? Every
not-
step?
you don't have to be like, okay, now I'm doing this, and the teacher will more observe what you do.
Okay.
Of course, if there's something you cannot like physically do, you might say that, okay, now I have done this, or now I'm going to
Okay.
do this, but just so that they know.
In Philippines, we have this book, actually, like a manual, where we have to go through every skills, and when you do the return demonstrations, you have to memorize step by step.
So you have to do it in the right order.
Yeah, and then the
according to
teacher
this.
will check if you have gone through that step. So
For us, it's more, yeah, of course, you have to do the right thing, and you have to, like, I remember, for example, we had a situation or a scenario where you got into the room and the patient is not, or the patient is not anymore conscious, like, meaning you will have to resuscitate. So what you do, how do you check that this patient needs it in the first place? What do you do next? You know, like all the steps. So of course, teacher will they probably have something that they check off, but it's not like through any or based on any book that I have read that, okay, you do like this and like this. It's more like you get into a scenario, then you think, what would I do in this?
So basically,
based on what we have talked about in the course.
So basically, if you have done that you have done the major things that you need to do, then you pass.
Yeah, and then you might just talk through the scenario afterwards, like what went well, what did
That's
not.
nice, because in the Philippines, you really have to do like step by step. Of course, there are nice teachers that allow you to just go through one skill or one task, and then if you have done those primary things that without compromising the patient's safety, or that you don't do really big mistakes, then you can
will
pass.
pass.
But most of the teachers really want you to follow the step by step thing, which is quite demanding.
But so if you have read that, then you might also know what kind of scenarios will come up because you've been given, or doesn't really.
Of course, we have those random scenarios, but we have those like hand washing
yeah.
or bed bath, something like that. So we have those in one manual where we have to go through them.
Okay.
Yes. And next, what we are going to talk about next, the
Practical training in the hospital or other, in the field, basically.
Yeah.
So how is that like in the Philippines?
Well, we come in group of students. Like in my case, it was the whole class. We were more than 20 or
So
no.
you all go to one place.
Yeah.
Okay.
Or not more than 20. Around 20 or 15 or something like that. Then we go to one hospital, one ward necessary, like sometimes one ward, and we overcrowd the whole place actually, and it's quite challenging for one. We call it clinical instructor to supervise us.
Okay.
So.
And this instructor usually comes from your school?
Yeah, most of the time from the school. And sometimes we do have clinical instructors, in-house clinical instructors, meaning that the nurse is from that hospital, yeah.
Okay. Yeah.
And you cannot start your duty when you lack those paraphernalias or the tools.
The tools.
Yeah. So if you lack
Including
your
the uniform.
yeah,
Okay.
if you don't have the scissors, then some of the teachers will not really allow you to work.
Okay.
Yeah, so that's quite scary. And that the uniforms should be bought by us. And how
But it's
about,
the same uniform as you use in class, or it's a different one?
it's a different one.
Okay.
Yeah. How about you? How about here in Finland?
Here it's like it's either individual, like you go alone to a ward or other type of workplace, or then it's a small group, like maybe there's 3 of you in a shift, and they are not necessarily all from your class. They could be from somewhere else, or yeah, like those are basically how it works. And then our instructor or supervisor is always from that workplace, so in-house.
So it's not from the school, right?
No, the teacher does not come there except when we do evaluation.
Evaluation.
Then,
Yes.
yeah. What else? Well, we don't need to bring any tools, and also the
that's nice.
uniform is provided by the workplace.
By the workplace, right?
So meaning you will have the same uniform as all the nurses. They will not really
Recognize if you're a student
no
or a
one
nurse.
will know based on your uniform whether you're a nurse or a worker there.
That's
It will
nice.
just be based on your name tag.
Yeah.
Yeah.
And how about what's this? Are you required with paperworks after the practice?
We usually have like a written assignment based on the practice. It could be a care plan or
Yeah.
like history of a patient. Like you would kind of follow this patient from coming to the hospital, going home, and everything that happens. And
How many?
No, usually it's one
Okay.
per per practice. It could also be some other type of assignment that you do.
For us, I remember that I have a lot of care plans in one practice area. I have a lot of care plans. That's what I remembered. I just don't know if I have to have all my patients' care plans. But what I remember is that we have to tell our clinical instructor, our supervisor, about the medicines. Every time we give the medicine,
Okay.
then we have to tell the supervisor about this kind of medicine. What is it for? What are the side effects, or the like sometimes how does it even like metabolize in the
Okay, so you really
in the
have to know
system?
it.
Yeah,
by
like we
detail.
have this very thick book of this how do you call it, like this pharmacology?
I don't know. Here in Finland, we have pharmacophenica. I don't know.
Yeah,
what
but we
is
have
that,
this
but it's a
drug
pharmacology
book.
Yeah.
Yeah, so that's quite intense during practice.
Here they might ask you questions like that, but not maybe as much in details. And you can always also ask your supervisor questions. If you don't know, then it's okay. They will tell you, and you will learn more. It's not the end of the world if you don't know.
That's nice. And also the supervisors here are they can say no. They can say that they don't know. If
I mean, that's just if they don't know, then they might ask someone else. Do you know?
That's very nice here that
Can you tell this student?
they can be open. Yeah.
Yeah.
Next, how about this summer job?
Yes. Once in Finland, once you have had at least one practice, like practice placement, you can work during the summer. Like when you don't have classes, you can work as a nurse or a practical nurse, depending on how many credits you have. So usually, if you do well in your practice placement, they will offer you a summer job. They usually come and ask, like, do you have a job for this summer? And if you don't, then they ask, do you want to come here and work?
So basically, once you had a practice place, that could also mean that you have more chance to get a summer job there, right?
Yes. And then, of course, if you have worked there in the summer, you could also be a substitute during your study time, like the rest of the year, they might call you.
Yeah. But I noticed that you don't necessarily have to be a very good student. You just have to
be like very
normal student.
No, you don't have to be exceptional in any way.
No.
You just have to be like
you follow the rules.
Yeah, and that you want to learn.
And
and then they will usually offer you, or if you ask yourself, you might also
Yes.
that might also be a way.
Yeah. In the Philippines, unfortunately, I think it's also true nowadays that you don't necessarily get a summer job. Yeah, it's only after you graduate that you get a job, but not necessarily even that you get a job immediately after you graduate. And it's nice here in Finland because when you get the summer job, it's quite good pay enough already. Like how much do you
Yeah,
do
I mean, it's not, of
nursing
course, the
students?
same as a graduated nurse, like a licensed nurse, but depending on your credits, you could get around 2,000 a month for working full time, 2,000 euros.
during summer, right?
Yeah,
Yeah.
yeah,
So
yeah. It
It's-
depends whether you're working as a practical nurse or as a registered nurse with limited, like
yeah,
limited. What's this?
experience.
Yeah, experience, but also what you can do is limited, especially when it comes to medicines. There's certain things you're not allowed yet before you have your license. But
So when a nursing student has enough credits, she can work as a nurse already. But
yes,
there are certain things that she cannot do or he cannot do. Right?
Mainly, you cannot give IV medications and such
Yeah.
things. That's maybe the biggest thing you cannot do. And then, then you can probably not be totally on your own. Like
Yes.
you need to have other nurse also there, but not necessarily with you all the time. You just
But if
work.
you don't have these enough credits, you can work as a practical nurse,
Practical
right?
nurse.
Yeah. Which is the salary is around like maybe 1.5 or 1.8, or is it like 1.8?
Around something like that. It
1,800
probably depends.
euro. Yeah.
Yeah.
So the salaries here in Finland, they vary from one city to another, or from one municipality to another.
And sometimes by workplace also, because there's private and public hospitals or
Yes.
care homes or other places.
Yeah.
Yeah.
So that's quite a good thing because it really helps the student to survive during summer because they don't get they don't get support from the government during summers, right?
No, because if you're Finnish citizen, you would during your studies, so like while you have classes, you get support.
How much you get support?
It's I don't know how much it is nowadays. When I studied, it was there's two parts to it. There's the study support and then there's a housing support. So altogether, it's around 400 euros
Oh my.
maximum.
We don't get anything. We have to pay a lot.
But that's kind of something that they want to do to support you to study.
Yes, that's
But,
nice.
Yeah, during summer you don't get it. So
Yeah.
that's why it's good that you can study. Or
And
not
you can
study,
work.
to work, I mean.
So let's talk about the graduation ceremonies or the licensing of.
Licensing. Getting a license as a nurse in Finland is pretty simple and straightforward. I mean, not simple because you need to pass all your exams, you need to pass all your practical placements and so on, get all your credits. But once you have done that, and then you graduate, you get your papers, you're a nurse. No more things that you need to do.
That's very easy.
Except in your workplace, we have this exam when it comes like medicine, like pharmaceutical things like that.
That you are allowed, that you will get permission to
Yeah.
give certain medicines.
Yeah, we have that, and you need to redo that during your whole career
Every 5 years, yeah.
But apart from that, we don't have like a licensing exam or anything.
Yeah. So
such.
once you graduate, you are a licensed you are a licensed nurse already.
Registered nurse. Yes.
Yeah, but does it require you to have certain cases that you have handled? For example, like how many major surgeries, how many minor surgeries?
No.
Yeah, because in the Philippines, you are required, before you graduate, you are required to have those different cases already like done before you graduate or before you are allowed to graduate. So I remembered like 5 major surgeries. You have to assist 5 major surgeries and like few minor surgeries and one like few like deliveries you assist during the delivery.
No,
during
no.
like
We
maternities?
don't have like that. You just have to get through like certain type of practice placements. Like there is some basic one, then there's, for example, home care, psychiatry, medical, surgical, and then depending on what is your specialty that you focus on, then that one. But no procedures or anything. No.
Okay, that's nice. And in the Philippines, once you graduate, then you have to prepare for the licensure exam, which is quite intense. You have to really study hard. Some people enroll themselves in a like a preparation like a preparation course for the exam. It's a national exam. Then you have to take that, and then once you pass, then that's the time you get the license, and that's the time you can practice. But unfortunately, I did not go, or should I say fortunately or unfortunately? I don't know, but I did not have to take that when I
So
went to.
basically, you're not a licensed nurse.
I am
You have
not a
never been a licensed
yeah.
nurse in the Philippines.
No, but I was just I was allowed to work as a nursing assistant in one hospital. Yeah, and then I was working like almost like a nurse. So basically, because the owner of the hospital is my friend, so they allowed me to, like, with, of course, with supervision of nurses. So I was allowed to do like some of the nursing stuff that, with their supervision. Yeah, but I did not really like do it by myself. Like, I was not alone in doing those things. So I did not have a license in the Philippines, but when I went here, I actually studied nursing also. So that's why here I am a licensed licensed nurse.
Registered nurse, yeah.
Licensed registered nurse. Yes. Registered nurse. That's licensed.
Registered
Yes.
nurse.
Okay, so I guess that will be all, and I hope you get something from this conversation, and I really hope that more students will come here to Finland to study. It's nice place to study because you have a lot of opportunities, and of course, hope that the situation in the Philippines has gone better from the time when I left there. But yeah, see you guys next time, and please don't forget to subscribe, and if you want videos like this, you
Comment below.
Yes, you can comment
Let us
below.
know.
Yes. And that's it. Bye.
Bye.